This is my student support system. Keep watching, keep learning.
Hello, welcome to my student support system. In today's class, we will discuss about hypertension. This lecture is in English, and if you want to study in Hindi, just click on I button and you will get link of Hindi lecture. Or you can directly visit to channel my student support system. What is blood pressure? Before understanding about hypertension, we should know what is blood pressure. So blood pressure is defined as the force that the blood exerts against the vessel's wall, means artery or this vein. So these are known as blood vessels. So the pressure against the wall of these blood vessels, artery or vein, this is known as blood pressure. This pressure depends on the viscosity or thickness of the blood as well as the diameter or sensibility of the blood vessels. Two terms are used to denote the blood pressure. These are systolic blood pressure and diastolic blood pressure. So what are these? Systolic blood pressure means the pressure exerted by the blood when heart contracts. Then this pressure is known as systolic blood pressure, and when the blood uh, this heart relaxes, and at the time of relaxation, when minimum pressure is applied on the blood vessel wall, then it is known as diastolic blood pressure. And now we come to hypertension. What is hypertension? Hypertension is defined as a systolic blood pressure greater than 140 mm of Hg and diastolic blood pressure more than 90 mm of Hg. So, and this blood pressure monitoring should be done at two different uh, point of times and two or more contacts. So when you visit your doctor first time and at first contact, when there is BP is 140 by 90, then we cannot say that this is hypertension. Okay, so two or more contacts are necessary and two or more times we will check. If both time it is greater than 140 by 190 mm of Hg, then we can say that yes, it is hypertension. So mostly when you visit a doctor, they ask you to monitor your blood pressure for few days at fixed time and note it down, and then you again visit your doctor, and then only the doctor will say that yes, you are hypertensive. Okay, now we should come at the classification of hypertension. These are the normal reference range for uh, blood pressure. Normally, the normal blood pressure is 120 by 80 mm Hg. And what is pre-hypertension? Pre-hypertension is 120 to 139 mm of Hg systolic and 80 to 89 mm of Hg diastolic pressure. Then it is pre-hypertension, and the client will be pre-hypertensive. And stage 1 hypertension is 140 to 159 systolic BP and 90 to 99 mm diastolic BP. And stage 2 hypertension is 160 mm of Hg systolic blood pressure and 100 mm of Hg or more than it, it will be uh, stage 2 hypertension. And this is something serious. You should think about that. Okay, now let us see why we should think about it. What are the effects of hypertension? Actually, hypertension is not a disease, it is a sign. And if it is staying for long time, then there will be some effects on our body. So what are these effects? We will discuss now. Hypertension is known as silent killer because it silently kills. Normally, in pre-hypertensive stage or early hypertension stage 1 hypertension, there are no sign and symptoms. So client cannot understand that he is suffering from hypertension. So, and when the client goes for physical examination and normal routine examination, then after taking blood pressure, then doctor may say, yeah, you are hypertensive. Then client say, oh, I don't know. And once the client becomes hypertensive, it becomes a lifelong condition. So regular monitoring is necessary. Keep in mind. So what are the effects? Prolonged blood pressure will affect the vascular system of our body. And as you know that throughout our body there are blood vessels. And when these blood vessels are damaged, then the target organs which are supplied by those blood vessels, they are affected. Particularly important organs such as heart, kidneys, brain and eyes, they are affected by prolonged hypertension. Uncontrolled and long-term hypertension normally results in myocardial infarction, means heart is affected, renal failure, stroke and impaired vision. So these important organs are affected by hypertension. That's why I told you. Now we should think about it if we are hypertensive. Pathophysiology of hypertension. Hypertension can result from two things. One is increased cardiac output and second, increased vascular resistance, or we can say decreased elasticity of peripheral blood vessels. So these two systems may lead to increase in blood pressure or hypertension. Actually, hypertension is a multifactorial disorder, means a lot of factors are there which may lead to hypertension. So what are those factors? We will discuss under causative factors for hypertension. First factor is effect of our nervous system. Actually, blood pressure is regulated by autonomous nervous system. And when there is increased sympathetic nervous system activity due to dysfunction of autonomic nervous system, then there may be chances of hypertension. Another causative factor includes increased renal reabsorption of sodium chloride and water, which leads to overloading of vascular system, and finally it increases the peripheral vascular resistance and then hypertension or increased blood pressure. Next is increased activity of renin-angiotensin aldosterone system. So what is this renin-angiotensin aldosterone system? You can visit my channel and there is one lecture on our kidney system. So in that lecture I have explained this renin-angiotensin system in detail. Okay, so increased activity of this system may result in expansion of extracellular fluid volume that increases the peripheral vascular resistance and finally it leads to hypertension. Another causative factor is decreased vasodilation of arterioles or arteries due to dysfunction of vascular endothelium and atherosclerosis. This leads to decreased elasticity of blood vessels and increased peripheral resistance. In the same way, resistance to insulin action, which may lead to hypertension, especially along with the type 2 diabetes mellitus. Hypertriglyceridemia means cholesterol is increased, obesity and glucose intolerance. Then aging, of course. Structural and functional changes in the heart and blood vessels contribute to increase in blood pressure that occur with aging. The result of these changes is mainly the decreased elasticity of the major blood vessels, which leads to increased peripheral resistance and finally hypertension. What clinical manifestations occur? As I have just explained you that it is silent killer. It doesn't tell uh, what are the clinical manifestations initially. So we can say that initially hypertension is asymptomatic, but later on the sign symptom may appear, and only symptom that appear initially is increased hypertension or increased blood pressure, and you come to know only when there is routine checkup. Later, retinal changes may occur, such as hemorrhage, exudate, arteriolar narrowing, and cotton wool spots in the eye when we check the retina. And in severe hypertension, there will be papilledema, means swelling of the optic disc like this. When specific sign symptoms appear, they usually indicate the vascular damage of a particular organ, and the sign symptom related to that organ appears. For example, if coronary artery is affected, then there may be angina, myocardial infarction that leads to heart attack. And when cerebrovascular involvement is there, means the blood vessels which supply the brain, they are affected, then there may be stroke or TIA, means transient ischemic attack, manifested by alteration in the vision or speech, dizziness, weakness, sudden fall, or paralysis, that is hemiplegia type of paralysis. So these are the main clinical manifestations of persistent hypertension. Okay, now we come how we will diagnose. We should visit our physician regularly for regular checkup, and the proper history and physical examination and blood pressure monitoring will be the best diagnostic investigation. Then examination of retina and some laboratory investigations are also very important to confirm the hypertension. Then routine laboratory test includes urinalysis, means urine examination, blood examination such as sodium, potassium, creatinine, fasting glucose, and lipid profile, which includes high density lipoprotein, LDL, cholesterol, triglycerides, etc. Apart from this, a 12 lead ECG is very helpful or important diagnostic tool for hypertension, and to find out the left ventricular hypertrophy, yes, of course, echocardiography is very important. And after diagnosis, what are the management? The basic goal of management in hypertension is to regulate the blood pressure within normal range, means below 140/90 mmHg. So we can achieve that. If we are able to achieve, we can reduce the death rates due to hypertension, and we should be happy with this. So to achieve these goals, what can be done? Research findings demonstrates that reducing the weight, reducing alcohol intake, sodium intake, smoking, and increasing the regular physical activity, walking, these are very important, along with medications under proper guidance of cardiologist, and routine simple exercise like walking will be helpful to reduce or manage hypertension. Thank you students for watching this video. You can subscribe the channel for latest updates, and for making your notes don't forget to visit this blog mynursingstudents.blogspot.com. You can make your notes here. You can follow me on Twitter, Instagram, and join Facebook group Nursing Notes. Thank you.